Vaccination saves lives.
A logistics challenge of delivering millions of doses while maintaining extreme temperature requirements.
It's got to be kept between not minus 70 and minus 90, which the driest can do.
Who gets the first shots? And when will everyone else get theirs? Answers to those questions and more on Plugged In, the COVID vaccine. Hello and welcome to Plugged In. I'm Greta Van Susteren reporting from Washington. Vaccinations are now underway here in the United States as the country's death toll passed 300,000, more than any other country. Shipments of the vaccine from Pfizer manufacturing plants rolling out across the country to air freight distribution hubs. In New York State, critical care nurse Sandra Lindsay was the first in the United States to be vaccinated. Healthcare workers and the elderly are first in line to receive the vaccine. U.S. officials say by the end of December they hope to vaccinate nearly 20 million people. VOA correspondent Michelle Quinn has details.
It's a moment of hope and a dark time. Trucks begin rolling across the U.S. this week, delivering the first COVID-19 vaccine, 2.9 million doses to states. The first recipients of the Pfizer-BioNTech vaccine, high-risk healthcare workers and people who live and work in long-term care facilities. The excitement at the beginning of the vaccination effort comes as U.S. cases of COVID-19 surge and deaths from COVID-19 approach a grim milestone. Nearly 300,000 people have died from the disease, according to the Johns Hopkins University. One state that is struggling is New Jersey, which is seeing a surge of COVID-19 cases.
For all the good news, the light at the end of the tunnel, and the vaccine exemplifies that as much as anything, the next number of weeks are going to be hell, I fear. So we're begging with people to please, please, please don't let your guard down.
As the vaccinations begin, the Food and Drug Administration will consider emergency authorization of a COVID-19 vaccine from Moderna. Public health officials are worried some people will balk at being vaccinated.
So there are a lot of people out there that are hesitant to receive the vaccine for any number of reasons. So I believe we've got to communicate the safety, the efficacy of these vaccines, the importance of what this means for us individually and for our global community.
The United Nations Secretary General Antonio Guterres has warned of vaccine nationalism, which could leave poorer countries struggling to get the vaccine. As countries feel pressure to shift resources for vaccines, there are other risks, says Chizoba Wanodi, Nigeria Country Director for the Johns Hopkins International Vaccine Access Center.
And so where is that money going to come from? That money is definitely going to displace healthcare spending for other things. And if you think about the burden of disease in, let's say, developing countries, there are a lot of people actually asking questions about weighing the benefits, right, of shifting funding to the vaccine versus other healthcare programs.
Other COVID-19 vaccines are on the horizon. Still, health officials stress that vigilance against the infection has never been more important.
The vaccine gives us great hope for 2021, but this current surge of increased disease gives us great pause. We still have to adhere to those three W's. Wash your hands, wear your mask, and watch your distance.
Michelle Quinn, VOA News.
It's important to emphasize that public health officials say vaccines will not have an immediate impact on the rising infection rate. In London, pubs, restaurants, and other public venues are closing, and people are being asked to stay home as much as possible because of a spike in infections. Great Britain was the first in the West to approve the vaccine. VOA's Henry Ridgewell has more from London.
Britain called it V-Day, or Vaccination Day, December 8th, the start of its mass coronavirus vaccination programme. The rollout began in major hospitals and is now being expanded to local clinics. About 800,000 doses of the Pfizer-BioNTech vaccine are being distributed, with several million due before the end of December.
Less than a year ago, we're treating the first patient with COVID, and we are now able to give a vaccine. The team has been incredible.
People over 80, the clinically vulnerable, and frontline health and nursing home staff are first in line. Doctors say by inoculating these vulnerable groups first, the pressure on hospital intensive care units will ease. So how did Britain gain the head start? British regulators insist full safety checks were carried out.
So there should be no doubt whatever that this is a very safe and highly effective vaccine. It will help us turn the corner.
But in polls, half the British public have safety concerns over the vaccine. The World Health Organization says it is vital that governments communicate clearly.
And the more open and transparent we can be, the more likely it is that people will have the trust and the confidence and would not only want to take the vaccine, but would also be patient and wait for their turn.
With Britain, the United States and Canada having now approved the Pfizer-BioNTech vaccine, pressure is growing on the European Union to do the same. Approval is expected by the end of December.
We want to do this in a very coordinated fashion and show that everyone has the same kind of access.
But that access will not be available to billions of people around the world. Aid agencies accuse rich countries of hoarding the vaccine.
9 out of 10 people in poor countries are not going to receive a vaccine next year and possibly for years to come.
Scientists say the world will not get back to normal until there is a global rollout of vaccinations.
Somewhere between 70 and 80% of the population worldwide will need now to be vaccinated.
That would require billions of doses of vaccine and is likely to take many months or years. Henry Ridgewell for VOA News, London.
Great Britain and Europe face some unique distribution challenges. I spoke to VOA's Henry Ridgewell from London.
Well, the primary challenge really is the supply of the vaccine. We know that Britain was the first country to approve the Pfizer-BioNTech vaccine. It had initially ordered 40 million doses. The first batch includes 800,000 doses, and they are here. They're in the country. We've got another 4 million that are due to be delivered before the end of the year, but we do know that Pfizer is having some production issues just getting hold of those raw materials that are required to make this vaccine. It's using genetic material that other vaccines haven't done in the past, and keeping that and getting all that raw material together is proving a challenge. That's number one. Now, for those vaccines that have arrived in the country, they have to be stored at -70 degrees throughout the entire storage and transportation chain. So they are being taken either by truck, by refrigerated frozen truck from the production site, which is in Belgium, across through the Eurotunnel into Dover, and then into storage sites at hospitals or at warehouses across the country.
Now, we're expecting this week here in the United States that besides the Pfizer vaccine, the Moderna vaccine. Do you have any idea when the Moderna vaccine, I assume that the MHRA, which is your regulatory organization, is going to rule on the Moderna?
I don't know yet when the Moderna vaccine is going to be approved. We do know that the MHRA is using the same processes on both the Moderna vaccine and the Oxford AstraZeneca vaccine that it did on the Pfizer-BioNTech vaccine, in that the testing stages, that safety approval process, was done in tandem with the trial. So the usual process is the drug company will run a trial, the results will be produced, the regulatory bodies then go back and look at the data that has been produced, and then they will give approval. And that process can normally take a couple of years at least. We know what the MHRA have done is they've been doing that approval process as the trial has been taking place, taking in the data in real time, if you like, And they've been doing that not only with Pfizer, but also with Moderna and Oxford AstraZeneca.
I mean, our country, the UK and USA are great friends, but many Americans wondered how the UK beat us to okaying the Pfizer drug, how MHRA beat FDA. But it got our nose a little out of joint that you beat us.
Yeah, it wasn't only you across the pond there as well. I think there has been huge pressure on European governments as well to match the UK in their speed of approving this drug. But you would have seen in America as well as in Europe that the governments there have said, look, this approval process is hugely important and we need to get this right. If regulatory bodies got this wrong and there were adverse side effects, imagine what that would do to public trust in not only this vaccine, but any other vaccine, not only for the coronavirus, but other diseases that would be produced from here on in. So that's the argument of the regulatory bodies. The MHRA here in Britain says, well, this is the process we followed. Unlike other bodies, we have done our approval process in tandem with the drug companies running the trials. We are 100% sure that our approval process is watertight. In their words, no corners have been cut.
But here in the United States, we're all great fans of the Queen. You know, we all love the Queen too. Has she spoken at all about the vaccine? Is she getting the vaccine soon? She's an older woman, but so she might be eligible a little sooner than most.
Well, indeed, she's in her 90s, and going by the list of those eligible, she would be absolutely in the top group. So the top level of people is care home residents and carers, and then number 2 is people who are over 80. So she should be offered the vaccine if she hasn't already before the end of the year. She and the royal family at large have not spoken yet about their intention or otherwise to take the vaccine. But one would have thought that she could play a key role in persuading the public to do so, that this is safe. Many scientists I've spoken to over the course of the past weeks or months say that figures in the public eye, and there is no greater figure in the public eye than the Queen here, or perhaps around the world, can play a really huge role in persuading people to do this. Politicians and all former prime ministers, and as in America, I think many former presidents have offered to take this vaccine live on camera and to be shown to be taking this. So I can see a key role here for the royal family if they are keen to do so. Of course, they have been trying to keep somewhat out of the public eye in recent months with difficult times with certain members of the royal family, Prince Harry and Prince Andrew among them. And so perhaps this would be a way to step back into the public eye, if you like, and play a very, very positive role.
How about your Prime Minister? Has he taken it? Does he intend to take it publicly? You make reference to our former presidents. President Bush and President Clinton said they will do it on camera. They're over 65. President Obama, likewise, he is under 65. But what about your Prime Minister?
He hasn't said he will do it live on camera, although he has said he would take it as soon as he is eligible. I suppose what politicians want to avoid doing is to look like they're jumping the queue by any means. But he has said that this vaccine is safe and that he will be keen to take it. You know, it's interesting. You speak to different people. My parents are both, you know, in those top groups as well to be eligible to take it. And for many, many older people who have not perhaps seen their family for several months, for those residents of nursing homes who haven't hugged their family for so many months, isn't this a ray of hope, a ray of sunshine that might all soon be over, that they can see their families again? And that's the case for millions, billions of people around the world. And it's going to be a difficult job for governments and global institutions like the World Health Organization to manage that expectation. And that was spoken of at a meeting this week in Geneva by the WHO about how you get people to be patient, to wait their turn. They've got to fight that battle on the one hand, and then persuade those who don't want to take the vaccine to do so on the other hand. So, you know, we've got over the major scientific challenges in producing these vaccines. The next big challenge is those social challenges of getting the administration of the vaccinations right.
Henry, thank you very much. And if I don't talk to you before the new year, Happy New Year. I'm glad to get 2020 behind us, as I'm sure you will be too.
Yeah, let's hope the new year brings good things.
Vaccine distribution in the U.S. is an effort that requires the government and private business sectors to work together. The first installment of the Pfizer vaccine, which is roughly 3 million doses, will be delivered to 600 distribution centers across the country. Rival shipping companies, UPS and FedEx, are splitting delivery duties. UPS is delivering vaccines to the U.S. eastern region, while FedEx delivers to the west. Both companies say they are prioritizing and tracking the vaccine shipments, which are packed in dry ice with temperature sensors to monitor and track the precious, life-saving cargo. Getting tested for COVID-19 has proved to be challenging with long lines at test sites and frequently delayed results. Now several experts who are trying to close the testing gap say technology is creating new breakthroughs in how we test for the virus. VOA's Matt Dibble tells us more from San Francisco.
Though COVID-19 vaccines are on the way, health experts are cautioning that the need for frequent COVID-19 testing will be with us for a long time. Adequately testing the U.S. population has been a persistent challenge. Now there is hope for a new approach: self-testing at home.
Rapid, sensitive, specific home testing, even one that you might not even need a prescription for, so that people can have within their own power to know.
Recent technological advances suggest that widespread home testing is within reach. The U.S. Food and Drug Administration has authorized the first at-home COVID-19 test that generates results in less than an hour. Dr. John Chu led clinical studies of the test.
It is essentially a lab test at home. On par, or at least close to par, as what we consider the gold standard PCR testing. There are enzymes in these solutions so that when the sample is placed, it amplifies the amount of genetic material that's there. The detector can detect it, and then within 30 minutes, a result will come out. How much nicer would it be for it to be able to be done at home and keep people isolated?
Chu says the tests will also provide an advantage when used in clinics.
When we can get results that are lab quality very quickly, we can help make decisions very quickly.
The company plans widespread distribution of the test in the U.S. this spring. Another breakthrough in testing comes from artificial intelligence. Researchers at the University of Oklahoma found that the cough of a person infected with COVID-19 has a unique sound signature that can be detected using AI, even in people with no discernible symptoms.
Then we built on that initial finding to try to create an app.
The app first had to learn to isolate a cough sound from all the background noise.
About 50,000 different type of coughs were used to train it, and then almost same number of non-cough sounds were used.
Then the app was fine-tuned using the coughs of COVID-19 patients. Similar research at the Massachusetts Institute of Technology shows AI can detect a COVID-19 cough with nearly 100% accuracy. Industry groups around the world have joined the race to bring cough-detecting apps to the public.
The beauty of this is that it is low cost and it is repeatable, and it can be done every day, and it can be done several times a day.
In 2021, testing for COVID-19 may become just another part of our daily routines. Matt Dibble for VOA News, San Francisco.
Since the beginning of the pandemic, healthcare workers have faced a monumental task, caring for COVID-19 patients and encouraging best practices like hand washing and mask wearing, while also addressing legitimate concerns about vaccine production and safety. Rupali LeMay is an infectious disease expert specializing in vaccine behavior at the Johns Hopkins Bloomberg School of Public Health. We spoke earlier about how public health officials are trying to educate and encourage the general public to get vaccinated.
So the biggest challenge is that vaccines don't save lives, but vaccination saves lives. And what we're hearing with our data from people that are hearing about the vaccine, hearing from their healthcare providers, is that they are worried that the process has been politicized, it has been tainted, and they're also worried about how fast the vaccine development process has occurred. It's a bigger challenge now than it was 6 months ago. However, on the flip side, what I would say is that unfortunately, because of the way that rates are going in this country, more people now know someone that has been infected or affected by COVID. And so from an acceptance standpoint, we are hoping that will help nudge people to be more accepting once a vaccine is available.
Whose job is it to convince or persuade?
I would say it's the job of all public health practitioners. So that requires doctors, that's nurses, that's pharmacists. Here in the United States, that's public health agencies as well. And overseas, it's also going to be, I think, governments. I think media is a very important partner for us that work in public health, particularly within this context. Social media has become a very important partner as more information, as more people, I would say, are getting their information from social media. To me, the role of the media is to provide evidence-based scientific information. It has to be credible. It has to come from a trustworthy source. I think with regards to these vaccine products, because they are new, it's going to be very important for us to be able to communicate very clearly what are the side effects that could occur so we can prepare people.
The level of skepticism that I'm hearing is in a number of categories. Some people don't think it's safe, that we have not done enough testing on it, so they feel insecure about that. Others don't like the government control. They think it's the government controlling. Some might have religious or cultural reasons, or some may say, I've had COVID, so now I have antibodies, and some may say, I'd rather just get COVID.
It varies, and I think pre-COVID, we could think about these buckets of concerns into 4 buckets. So safety, as you mentioned, adverse events, ingredients, schedule, a vaccine schedule, and then low levels of risk perception. I think that has changed with COVID. We're still hearing, I think the primary concern is safety. People feel as though it was a rushed development process, even though it still went through a rigorous safety and efficacy oversight.
Pfizer has been given emergency use authorization here in the United States. Moderna were expected later in the week. These are both developed in the United States. How do we address from an ethical standpoint, and even from a sort of a global response to, dealing with it and giving it to other countries, making sure it's distributed to other countries? I mean, how do we make that determination?
Here, there has to be a bit of give and take. Countries that are richer and are able to produce vaccines for their population more quickly and efficiently need to be able to help countries that are struggling and that have fragile governments, for example. And so there's been a lot of discussion of how do we ensure that the distribution is equitable? A lot of bioethicists have also talked about this. The National Academies of Science report that came out about a month ago also outlines this, and it's grounded in an ethical framework. And so I think thinking of all these things collectively will help us hopefully make the right decisions with regards to distribution.
How about globally? Do you have any information on whether or not the vaccine is going to be received well globally?
There was a recent survey that looked at about 19 countries, and I believe it was about 30,000 participants, and saw that ranges of acceptance ranged from 50% in Russia to 90% in China. So there are huge bouts of variance. I think it very much depends on the prevalence as well as the response with regards to whether or not the population trusts the government.
Any information on the African continent?
The African continent has fared quite well, relatively speaking, I would say, with regards to severity of cases as well as prevalence. I know a number of leaders shut down their borders quite early on in the pandemic when just even 1 or 2 cases were detected. So I think rollout there will be much easier only because a lot of residents have dealt with other infectious disease pathogens such as Ebola, for example, and that is quite fresh in their minds.
Are you going to get the vaccine?
Absolutely. I will get the vaccine, but I'm lucky that I'm not at high risk, so I will wait to get the vaccine. And until I do get the vaccine, I will continue to stay home, social distance, wear a mask, and not see anyone else.
So you don't have any fear of the vaccine?
I do not. I have faith in the process.
Thank you very much for joining me.
Thanks so much for having me.
The Pfizer-BioNTech coronavirus vaccine must be stored at extremely cold temperatures, raising concerns about shipping it across the country. Dry ice companies in the U.S. say they are prepared to meet the challenge. VOA's Isha Sarai visited one such company in Baltimore, Maryland.
As the U.S. moves the Pfizer-BioNTech vaccine against the coronavirus, a big challenge will be keeping the vaccine cold.
It's got to be kept between not minus 70 and minus 90, which the dry ice can do.
But this dry ice maker in Baltimore, with decades of experience and 5 warehouse employees, says it won't be competing for business.
This is going to be a national deal. I don't believe there's any one dry ice company that can take care of all that.
Most companies like Capital Carbonic are already producing the specific size and shape of ice. Pfizer, and likely other vaccine companies, would require the ice to come in a pellet smaller than the standard 5/8 size.
It's a lot. It'll fit down in the boxes a lot more than a regular 5/8 standard pellet. This is for a lot of biomedical researchers that use this.
Although the task seems daunting, Weldon says that having worked with the National Institute of Health for years, his company is up to the challenge.
We're ready. I mean, our tanks are full. You know, I mean, we're capable of running 7 days a week.
And Capital Carbonic does expect that once distribution starts, dry ice production will be a 24/7 job. Isha Sarai, VOA News, Baltimore.
The COVID-19 pandemic has affected restaurants and small businesses particularly hard, with many stores scaling back hours, laying off workers, or closing permanently. In New York City, one of the country's oldest and most famous bookstores is getting a helping hand. The story from VOA's Anna Nelson.
My first memory is walking into the store and just kind of seeing it kind of painted ghostly gray and seeing all the walls of books everywhere and smelling that kind of chocolatey, and seeing my grandpa and my dad working side by side at the buying desk, heading straight back to the children's section where it was just candy-colored books, and I felt like such a princess because I could pick out any book.
Nancy Bass Wyden is the third generation of the Strand owners. 93 years ago, her grandfather opened the store that later became one of New York City's most famous bookstores. Today, the Strand is in a myriad of New York City guides as one of the most unusual, largest, and oldest bookstores in the world.
This is the most expensive book in the store's current possession, and it's a limited signed edition of James Joyce's Ulysses, all of which were signed by Henri Matisse, who was the artist who illustrated it, signed also by James Joyce.
The Strand has survived the Great Depression, 2 World Wars, and 9/11. But the COVID pandemic has become the store's biggest challenge. The store was closed for 4 months, and its financial troubles are getting worse.
Of course, at first it was very painful, and I very much felt all alone, and I didn't know what am I going to do next. So I decided I would write a letter, a heartfelt letter, and appeal to our customers and my friends and see if they would. The only ask was, would you buy your holiday gifts from us?
3 hours after the post was published, the Strand's website crashed. 25,000 online orders came in simultaneously. Before the pandemic, the daily average was around 300.
We had one lady from the Bronx, and she put in an order of 197 copies of, and we've had people just volunteering to give our employees pizza parties. I mean, lots of $500 gift cards.
The packaging department couldn't manage the tsunami of orders, so Wyden joined them. The store's employees voluntarily came into work on weekends to help with the orders.
It was sort of a combination of wow and uh-oh. Yeah, you know, we instantly started figuring out how are we going to do this.
Thank you, New York, for today.
At the same time, a giant line snaked outside the Strand's entrance. For the first time since mid-March, New Yorkers in large numbers came to the bookstore.
It's really sad. So everyone's getting books this year for Christmas. Everyone I know.
Thanks to simple acts of generosity, Wyden says the store will survive however many more months of the pandemic there are.
I have to think that my grandpa and dad are looking down at this turn of events and are absolutely floored and cannot believe this phenomenon. And I never would have imagined this outpouring of love.
For Anna Nelson in New York, Anna Rice, VOA News.
That's all the time we have for now. My thanks to Rupali Lemay from the Johns Hopkins Bloomberg School of Public Health. And stay up to date on the latest news at our website, voanews.com, and follow me on Twitter @Greta.